Dear Mr. Chairman, ladies and gentlemen, my presentation about the first clinical result of treatment of keratoconus of patient with thin cornea is an advanced technique of corneal collagen cross-linking. Nowadays, collagen cross-linking is limited to eyes with a corneal thickness of to the least 400 microns, down to the concern about the cytotoxic effect on endothelium, crystalline lens, and other intraocular tissue. This threshold has limited its performance in eye with advanced stage of corneal ectasia. The downside, the current pachymetry is patients with keratoconus or keratoectasia often have cornea that is thinner than 400 microns threshold. The exact protocol of cross-linking entails a deepitalization prior topical administration of riboflavin, which is macromolecular and therefore cannot penetrate intact epithelium in adequate concentration achieve corneal cross-linking. When the corneal thinking less than 400 microns, it is necessary to perform the hydration of stroma, hypertonic of riboflavin. This is unadvantageous because low predictable corneal edema reduces post-uncorrected visual acuity, longer rehabilitation. So, this proposed clinical study to examine the effective and safety of operation in advantage method of cross-linking at patient with cornea thickness less than 400 microns. As material as researcher group, this is first group, 10 patients, 10 eye with Amsler keratoconus classification stage first and second, in minimal corneal thickness of less than 400 microns at the thinner point measured by ultrasound pachymetry after epithelial removal. Middle age made 32 plus minus 48 years, average thickness of cornea is cornea central zone made 386 plus minus 26.5 microns. Pre and post-operative complete ophthalmic examination include anchored and best corrected spectral visual acuity, corneal topographically, a non-contact endothelial speckle microscope was done. Collagen cross-linking carried out with use of contact lens extracted from poly 2-hydroxymetacrylate, so metacrylic acid with content of water of 53-57% and with possibility of transmission more 19% and long wave ultraviolet 400 nanometers. That at almost complete correspond to degree of transmission of type of ultraviolet layer of epithelial and corneal stroma, thereby increasing the general thickness. We conduct research absorption of ultraviolet contact lens after the solution the lens was rinsed in the distilled water and clamped between two quark plates. The water transmission separate registered, and the lens was soaked 30 minutes in dextrolink and then registered similarly. Separate transmission dextrolink registered and then it was considered. At the last postoperative visit, keratotopography shows a small mean reduction in the curvature apical ectasia. Kmax value reduced up 2.64 plus minus 0.81 diopters was noted. Keratometry astigmatism reduced up to 0.95 plus minus 0.5 all patients. And the uncorrected best vision acuity increased on the average for 1-2 lines, and best correct vision acuity for 1 line was observed in months after the treatments. All patients attended 6 months follow-up. 1 year's follow-up result was available to 7 patients. All procedures were unfull and no intraoperative complications were observed. No damage to the limbal region. Any patient was observed endothelial cell density was unchanged. So, to conclude, Cortical cross-linking with our novel protocol appear to be safe, effective in the treatment of progressive keratoconus with our keratoectasia in cases when the central thickness cornea less for 100 microns after depitalization. Thank you for your attention.